Welcome to the Tudor Dixon Podcast. I'm Tudor Dixon, and I'm so glad you're tuning in today because today I am joined by someone I recently met, and I was blown away by all of his knowledge in the health space, everywhere from pain to COVID, a lot of the subjects that we're talking about right now. So I wanted to make sure that he could come on and talk to you as well. I invited him here so that we could learn more. Welcome, the medical director at the University of Wisconsin's Pain Clinic, Dr. Alaa Abd-Elsayed. I want to make sure I know I'm probably not saying that perfectly right.
You did it actually perfectly right. So thanks for having me.
Thank you. Thank you so much. Well, so we met at a meeting out in Austin, and you were talking to me about not only pain, but a lot of the stuff that is happening in or was happening in the COVID space. And I think that we still all have a lot of questions about COVID. Obviously, we see it every single day on the news, whether or not we're going to hold China accountable for this. So that is a political question. But behind the scenes, if you could just give us a little kind of update of or information about what you saw, because I know you said that you saw things that you just thought weren't exactly the way they should have been in the medical community.
Yes. And again, thanks for having me. And it's been great to meet with you and get to connect. And thanks for having me on the podcast, because it's very important to have those media outlets to start talking to people more about science and what we see in the medical field, because we've been all as physicians watching TV, listening to our politicians, which I respect so much. But then talking about things that we thought are, inaccurate, missing some information, or not showing the two sides of the story. And I'll take an example. Overall in science and in the medical field, there are a lot of things we do that I didn't see happen with COVID or with the political controversial topics around healthcare, which made me always wonder why we're going yes or no, while the answer is almost never yes or no. And I'll speak about COVID. COVID, for example, it was one direction we're taking when we speak about the origin. It's one thing. Everybody was led in one thing. We didn't keep the options at one point to open. It could be this, it could be this, or it could be that. What's happening. When we spoke about the vaccine, I mean, the vaccine was important. People were dying all around. But then as we spoke about the benefits of the vaccine, we never spoke about the side effects of the vaccine. And again, I'm not talking here being pro or anti-vaccine or anything. I got vaccinated myself. But the people need to make a decision based on information.
Well, that I think, I mean, honestly, it's something that we talk about in our office all the time, because we all feel like we didn't have a whole lot of information, but we were forced into it. And now that you see some of these things coming out, there's a lot of fear over, what did I do? What do I have in my body? What could this mean? Can you give us any clarity on that now?
Yeah, so vaccines have side effects. All vaccines have side effects, and the COVID vaccine has side effects. And I think what's happening is we're just not talking about side effects overall. We're just talking about do it will help you, you will not die. And it could be it's a risk-benefit decision. But people need to understand also what are the side effects of the vaccine. And again, it's
and what are the risks to certain people, I think, because maybe I would have made a different decision if I had really been clear on my risks not being that great. And it seems as though a healthy 45-year-old person is probably not at as high a risk of dying from COVID. But now we've seen some of these folks that have had strange things like heart attacks and blood clots. And I think we're all wondering, are those connected to the vaccine?
You are absolutely correct. So when the vaccine came out, and now we have more data on the vaccine, definitely we need to study those side effects more. But the vaccine can initiate autoimmune responses, including autoimmune diseases, which in line of everything you mentioned and more. But we don't have data, which is a problem, because when we don't have data, people start making assumptions. We don't know, because we don't know, which can go good or bad. That's why we need solid information about the benefits of the vaccine and the side effects of the vaccine. And as you mentioned, people need to make the decision about, do I really, maybe I'm not a high risk of the vaccine. I'm fine. I'm healthy. It's a personal choice. Or maybe, there is some patients with respiratory disease, immunocompromised, will die if they don't take the vaccine. So I'll take the risk and take the vaccine. But
But
unfortunately,
it wasn't really a
yeah.
personal choice for a lot of people. A lot of us had to say for our jobs, yes, we'll do this. I mean, have you ever seen anything like this in medicine before?
No, I don't recall. There are always ways to sign waivers or like your personal
Hmm.
responsibility not to take a vaccine. So again, but that's what we're seeing now, and that's what I'm researching myself right now with my team. We're trying to look literature because people need to understand the risks and benefits and make the decision that suits them. And again, in a way that doesn't, of course, harm the public health. But in many jobs, people were sitting home working on computer. I thought they could make the decision because they're not harming others. I think some of the claim was like, if you don't take the vaccine, you might infect others and stuff. Another point here, we didn't know people got the vaccine and they got infected too. So there's a lot of
Yeah.
questions and scientific facts that I just feel we need to study more. We need to be transparent, publish what we have, and make people understand what are the benefits and risk and make a decision.
Is that information readily available? I think there's a lot of confusion from someone like myself who's outside of the medical community. We know that when these were approved, that there was immunity for all of these pharmaceutical companies, that if you were to go back and say this harmed me, they were really immune to any side effects that it had. So do they also not have to provide what the data is that they've found, or is that readily available to folks like you who might say, okay, wait, I want to do some research on this and figure out exactly whether or not some of these young people who are just, you see these died suddenly websites, and you don't know whether this is mass hysteria and it's just coming up with people who you would have never known about, or if we really should be worried. So I just kind of feel like we need someone to tell us whether or not we should be freaking out or say, okay, maybe this is not as bad as we think.
Exactly. So all the questions you mentioned is questions we have. It could be a great vaccine. It could be beautiful, but we don't know. So we don't have access to any of this data other than uh, we're gonna search in the literature, see what people published about risks and benefits of the vaccine, and make just what we can find in literature. But we don't have access to the company's data, which is something
Is
probably
that normal?
no, it's not normal. Everything should be disclosed. It's public data, it's public vaccine, and everything should be disclosed.
Why can they get away with that?
You probably know better than me, so I don't know why. Like
That's
this has
scary.
to be, and again, it's fine. The vaccine came at the time people were dying and stuff, so you could look back and say that totally was the right decision. But people need to disclose the data and show. Particularly, this is now becoming an annual vaccine, so people need to look into data into not only this vaccine but all other vaccines. Look into what is the risk and the benefit, and have people make their choice in a way that it will not harm the public safety or colleagues at work or anything.
So, from your medical perspective, do you think that this should be mandated in schools? Should young children be taking this vaccine?
No, I don't think anything should be mandated unless, again, again, in my family, my son was below the age of vaccination, and when the research came out, it was inconclusive to his age, and he never got in the vaccine. Because I'm a physician, I like to look at science and the data and see how can I, make the appropriate decision. And that's how we all should do. But it's hard to make decisions without knowing the risk and benefit. And I can assure you, if we show the risk and benefit, I'm sure there are people still need the vaccine, but maybe some others will decide I don't need it that much and I'll take the risk. So it will be a personal decision.
It's surprising to me that we don't have more people coming out and saying, well, we're demanding, now that we've had a few years of this vaccine out there, we're demanding that the data be publicly available. Do you think that it's because folks that know that it's not publicly available are also afraid that they will not be given the right to research, that they'll be stopped? Or is it just that people just don't really understand that that data is not available?
I'm puzzled myself by this same question because I don't know why the data is not disclosed. It's science, and again, when it came, it was a first. Even if the data is bad, I don't think many people will blame it. We didn't know then what we know now, but given now we have years of data, it definitely should be disclosed. And again, if it's in favor, why not? So actually, this is happening in the medical field at all levels. All companies are disclosing their databases. and having people have access. Like I'm an investigator on other research, for example, and I do have access to data. And again, if it's good or bad, it's science. We can't just, that's science. It can go good or bad. It can be risk or benefit. I mean, many medications before came to the market and it was withdrawn after years because they found that they don't do what they do. And I wanted to tell you from the scientific perspective, when you start a research, you do your due diligence and you come up with a product not to harm people, but data shows it's a good product. But then you do what's called the post-market analysis, which should be done for all products. So the post-market analysis, after launching the product in public, we do the post-market analysis and look at it. And if it's good, we continue. If it's bad, we withdraw it. That's a routine process that we do in all kind of products. So it should be implicated for all, for the vaccine and other vaccines and anything else we use to make sure that the post-market data support the initial studies that led to launch into the market.
It's interesting. It makes us feel a little bit like what did they find that they don't want to show? But I also think that maybe they are afraid that if there's any negative that comes out, I mean, this was mandated. We've never really seen this before. It was mandated before those studies were able to be done. So maybe there is some, I don't know, committee or group that has decided it's in the best interest of the government and pharmaceutical companies for us to not allow this data to come out right now. Because, I mean, even if I think that right now, the way the country is, even if there was a little bit to be concerned about, because as you said, the science is the science. If it comes out bad, it comes out bad. But if it comes out bad, so many people will really, I mean, there could be mass hysteria over that.
It can be, and everything you mentioned is exactly correct because we don't know. If we don't know, we don't know. So we're just chatting here because we don't know, and everybody in the medical field and the public doesn't know as well. But the routine process for anything is that we look at post-market analysis, we look at the data, and sometimes it's bad, it's fine. I have done clinical trials before where the results are negative. It's okay. That's why we do them.
So these blood clots that people have been talking about, is this something that seems unusual? I mean, we even had a young child at our school, 15 years old, suddenly pass from a blood clot, a healthy young person who was in sports. And I think that when that happens so close to home, but then we're seeing all these other stories of, 30-year-old, 25-year-old on the football field, all these young people who are either having strokes or heart attacks, blood clots, dying suddenly. Do you think that this is an odd number of blood clot type situations in these young people?
I'll be able to answer this question for you precisely, hopefully in the next maybe 2 weeks, because we are about to conclude our research that we did on literature on that topic. But the thing is, the numbers, I mean, they look to be higher, but we're looking statistically if they were really actually higher than previous years. We think they are. And we're trying to look into we're trying to look into the factors that could lead to that kind of outcome. So far, the research we've been reading is inconclusive, but there is something we need to consider that what can happen in the previous few years. Could it be the vaccine? Could it be COVID infections? Could it be stress? Could it be because they've been happening since 2020, the world is not the same anymore. And that's the...
Gosh, that's true. Yeah. The amount of stress that we are under. And I guess I don't think that we've considered how much that changes your body. I mean, we were just talking about this over the weekend at church. Our pastor was saying you have to understand that anxiety can be created from an illness or it can create an illness. And so how much have you seen the impact on people's mental health affecting their physical health in the past 2 years? Because COVID was just a shock to everyone.
It's beyond what you think. I mean, we're looking at the numbers, but I'm definitely even observing it on my day-to-day basis. And I mean, it's like beyond what you think. And I want to tell you, it's not only the anxiety. People went into depression and anxiety, and which definitely cause physical illness. So, for example, if people in severe pain or anxiety, their heart rate will increase, will work more, will require more blood. They can get cardiac arrests. Their blood pressure will go higher. So mentally and physically, what happened in 2020 is definitely a dramatic change. And unfortunately, the number of people who couldn't cope with it are more than I thought. Because I think we all were working, we all went in the same stress, but a lot of people didn't came out the same, and they continue to suffer the consequences mentally and physically, which is something we need to focus on to correct what happened to people since 2020.
I think that we also thought, well, kids aren't, this is all they know. It's not, it's not going to affect them. But we saw tremendous differences in our kids just from being trapped at home. I was talking to a mom the other day of one of my daughter's friends, and they're all 14, 15, 16-year-old kids. And she said during the pandemic, I felt so bad because they were trapped in the house and I was not on them about exercise and going out. And I just didn't really think about it. And she said we ended up having a massive weight gain with our kids in our house. And I think that's been something that we haven't considered either. We were all very stagnant. We all just sat and I think back to that time in Michigan, my kids really weren't in the neighborhood. They weren't supposed to go outside because they could run into other children. And there was a long period of time where kids just didn't get to be kids. What are the health impacts at such a young age of things like weight gain? I mean, we hear weight gain can be so hard on adults, but we're seeing that in kids.
Again, very important point in kids. And again, because I have kids, so I'm very passionate about what you just said. So my son, when the pandemic happened, was 3 years old, and he all of a sudden wearing a mask at 3 years old. As a kid who's learning to write, speak, interact with other students, I kind of remember one day he came to me he gave me a hug and told me, "Daddy, I don't have any friends," which broke my heart because he was not going to school. And we started getting him out some pictures of his friends to remember. And so it was devastating. And the problem is if people didn't pay attention. So here is the deal. When stress happens overall, which, I mean, the pandemic was unprecedented to us and on our kids. If you're not really cautious how to cope with it, I can assure you anybody who doesn't know how to cope with this will go into a huge psychiatric problem, whether an adult or a kid. So we have to be very aware of our mental health and seek help immediately. If anybody or their kids having a problem, it's not a stigma, it's not a shame. Please go seek help because it's a very slippery slope. You can get the help, you can get back on track. And if you let it slide, it will develop into severe mental illness, which eventually, I mean, if we're not doing well, our kids probably will not do well as well. We need to all be aware of our mental health and seek help for our kids if they need it. Coping obviously was not easy for many people, but it's not too late to seek help and just get out of the stigma of seeking psych help.
Well, that actually leads in nicely to talking about chronic pain, because that can lead to depression as well. And that you work at the pain clinic. I know you've done a lot to treat pain with something outside of opioids. We have a crisis across this country. So I think when you add in depression, chronic pain, and opioids, you end up with a different type of epidemic. And it seems as though we have had a drug epidemic across this country. Really, it doesn't matter, it doesn't discriminate, doesn't matter your age, doesn't matter your socioeconomic status. People are getting pulled into this opioid epidemic across the lines of the country. But you've come up with some ideas to do something different. What motivated you to do that, and how have you helped other people get out of this opioid epidemic?
Another great topic. Thank you for bringing this up. Yes, so I came to Wisconsin in 2014, and I was privileged 1 year after to join the state board, and we did all the policies around opioids. So number one, when it comes to opioids and pain, overall, when you have pain, people tend to not to move. So I want you to think of this nice 7-year-old patient, whether male or female, severe knee pain. They start sitting more, not walking, not walking their dogs, not visiting their kids. They start gaining weight, eat more. You know how you sit on TV, popcorn, and start gaining weight. And then you put more weight on the knee, it gets worse. And then you're not visiting your family. You start developing, be depressed, anxious. You start blaming them for not visiting you. And the family dilemma and the social problem create depression, stress. You go to your physician asking for opioids. And it will be unfortunate if they treat this with opioids, because you take opioids, you become more sleepy, you gain more weight, you become an addict. And all of a sudden, it went from some knee pain to now psych problem, weight gain, more pain, lack of social life. And actually, we have seen patients who committed suicide immediately due to this. And that's not how we practice here. We see them in other practices. How we do it here is we try to do everything other than opioids, and there are many other medications, procedures, interventions. We do whatever it takes to avoid the use of opioids, because we know opioids is just the way the body will get used of them. They will develop craving. It's a physiological process. It has nothing to do. I mean, some people are more vulnerable than others. And we mentioned some people are not cautious about developing the craving. Some others will be and will stop. But most people are not aware. So it's a physiological process. And I keep telling the patient, no matter how strong you are, it's your body will crop for it. It's not you. It's a physiological process. You take it, you want more. It's drugs. You can't say, I'm going to use heroin for the next month and I'll be fine. I will control. No, you will not control it. It doesn't change your brain. It doesn't change your needs. And you will keep asking for heroin. So that's why don't just start it, because it will lead to this. Of course, they are appropriate for certain patients, but it's not appropriate for many patients that take them nowadays. We looked also into data. We found that the US is probably the highest worldwide consumer of opioids. So it can't be the only. We are the
Really?
highest consumer. In some medication, we
Oh,
consume
wow.
80% of the world medication in certain types. So, and we're publishing on
Whoa.
this data now because people need to understand. And again, I like to speak science. I speak to my patients. I tell them the whole world is managing it without opioids. If you go to other countries, getting opioids is close to impossible. And they treat their pain fine. They do fine. They do other things. So
That is, but I will say it seems as though it changed over the
Mhm.
past few years because I was diagnosed with cancer in 2015 and I had my surgery in October of that year. And I came home with bottles of opioids that I was never going to, never, and I never did end up using them. And then my second, so then I had to go back for a second surgery and I came home with a smaller bottle. And then I ended up having a third surgery that was the exact same as the second, and they sent me home with Advil. And this was in 2019. So it seems as though there were some changes even in the medical system over that 3 to 4 year period.
Absolutely. First of all, sorry to hear you had those surgeries and cancer. I had no idea. So you've gone through a lot in surgeries, and probably you're familiar with how pain can be and how it can be managed. And everything you mentioned is very accurate because over the years, definitely we started flashing the light on this and the public health problem, and it has improved. For example, the national surveys found that about 65 again years ago, 65% of patients who get an opioid prescription after a surgery, they don't actually use it. They don't need it. So we
Yeah.
started developing algorithms about which surgeries, maybe big surgeries, you need opioids, the others take ibuprofen, Tylenol, or we started saying, oh, give only 3 days. If you need more, take more. So definitely what you say is absolutely appropriate and really accurate about we shifted from, because when you have the bottle sitting at home, you wonder what's happening to that bottle. Kids are having reach to it, adults. Then people develop pain after a year and start self-medicate, and it all lead to what we talk about now. So it has definitely improved, but we need to do more work because I feel the pandemic, unfortunately, was the lockdown. People got back on opioids because you couldn't go to a surgical center, you couldn't get an injection, you couldn't get many other services. Usually, you need to go outside the home to get. So we have seen another rise. We have seen fentanyl, which is another huge problem, like coming to us from other countries, which is now probably the major health problem. Still an opioid, but people have reached to it illegally. But so the problem continue to exist. It has improved, but we need to still continue to do some work.
Yeah, it's funny to me because I think that younger kids now are learning about the dangers of drugs in school. And my daughters heard someone on the news the other night say something about some medical professional talking about using fentanyl in the hospital. And they were like, how could they possibly? I think it's interesting to me because they understand how dangerous it is. They don't understand that it actually can be used in very small doses in a medical setting. How do you think that this epidemic that we've seen is affecting young kids? Because I remember when I was young, it was the whole, war on drugs, and we were involved in these different committees at school to talk about it. And we really talked about it quite a bit in middle and high school. And it seemed as though for an entire generation that stopped.
Yes, unfortunately, education is a whole another public health problems, in my opinion, because we started talking in schools about things we shouldn't be talking about, and we started to be more disorganized. Like you mentioned, there should be some forums of scientific discussions for kids to learn about what's going on. Unfortunately, the resource became the TV, and the TV, it's they talk what they want to talk to serve certain, I don't know, political or certain
Mm.
personal beliefs, ignoring science to big part. That I myself stopped even looking into the news media anymore. because it has to be more done again based on science, based on literature. Even when I talk to my kids now, I'll bring up the computer, I'll bring them an article that's respectable, makes sense to read. We can't just have our information from others, people's opinions. This is completely wrong. And again, we need to look at data, we need to look at literature, and we need to have the appropriate forum scientifically to teach people. And I worry so much about the generations growing up not thinking this way, because we see the randomness that can happen and the brainwash that can happen if we don't teach people. Go to a resource to learn about things.
Yeah.
Again, we need to turn our kids, go to a resource. They come to ask me something, I'll tell them, you know what, just let us go on Sunday, ask our priest about this religious question. If I don't know, we need to have good resources, scientific,
Well,
based from people who know what they're talking about.
and you actually are one of those. I know that you have put stuff out on social media, and I think this is interesting because a lot of young people don't know. Young people are experiencing pain now, I would say, in higher levels than when I was young. We have fibromyalgia. People are talking about these things now. You've got sports injuries. I know a lot of males, especially when they have a sports injury, are less likely to want to talk about it because they don't want to look like they're in pain. But these things exist, and I think normalizing it, having a doctor out there talking about it, helps to give them a safe space to at least hear and then process that, and maybe talk to a parent or a coach at school or something. So where can people find that? Because I know you're out there. I know you're trying to help folks. So where do they find you?
Oh, thank you. So first of all, I started teaching on TikTok, on Instagram. Unfortunately, my Facebook got hacked the last week, so I'm trying to retrieve it. So it's either right now, but I'll be teaching through Facebook, through great people like you who invite me to talk, to spread the word out. I publish and I do research. I edited 30 books, and I'll keep teaching more. And that's what we need to do together. Just keep teaching, teaching, teaching. The outcome is the outcome. That's why we go transparent. We do our work. We do our science. And whatever comes, let people know about it. There is no shame at all from even coming back and say, sorry, this is the data I had. And this has happened historically a lot. People came up with good data and then said, no, it was not good. But why not? It's better, now than never, just to always teach and change your mind. It's fine if you find something different, and just keep the integrity, the science, and avoid the personal opinions, which are unfortunately very, very harmful.
And I think also, if you're feeling pain, there's no reason to feel ashamed about that. I know my mom was taking care of my dad when he was sick, and she had severe back pain, and she just kept pushing it off and pushing it off, and finally went in and said, I've got this severe back pain. And they said, actually, this is your hip. You need to do something about your hip. But there's still anxiety about that. And I think that it's something that we need to say. When this happens, it's okay to be concerned about it, but make sure you're looking at what the options are, because you don't necessarily have to be downing opioids every day.
Completely. And actually, one more piece of information that's important: when you treat pain early on, like if I had pain and in 3 months I went to seek help, the chances of recovery are way higher than if you wait 3 years. Because it's, the brain start actually, the anxiety and the brain start actually making some changes that becomes what we call a central pain, where it becomes much harder to treat. So actually, early intervention have shown by science to improve the outcomes on the long term.
Interesting.
Yeah.
Interesting. So you heard it here. If you're feeling pain, take care of it now. I do think that you can it becomes a part of your life, and then it is very hard to ever get over that.
Yes. If you have pain, if you have psychic problem, if you have any problem, please go seek help and don't let it get you.
Well, thank you so much. We are definitely going to have you back when you have I know you said in 2 weeks you'll have that data. And that to me is incredibly important, because I do think, I'm one of them, that I see these things where people have blood clots, and I'm like, I'm just waiting for what's going to happen to me. I'm always nervous about it. So I love the idea that you are looking at this so that we can have some clarity. And let me ask you this, because like I said, I am worried about this. If there were something that said people are at a higher likelihood of having blood clots if they've had the vaccine, then is there some way of monitoring that so it's not some shocking, horrific event?
Absolutely. So we need to, again, find the data first. And again, we will talk about what we find. If we find there is no relation, there is no relation. If there is a relation, there is a relation. We just need to look what's going on, and then take the corrective, appropriate measures, at least, through our education, if we can, through reaching to our politicians to just have, more science and politics working together for the good of people.
Yeah, let's come together and start talking about this stuff so it's not so dramatic. That sounds good to me.
Yeah, thank you. And thanks for having me again. And thanks for doing what you do.
Yes, absolutely. Dr. Alaa Abd-Elsayed. I hope I'm saying that correctly
Perfect.
again. We want to make sure that people are able to find you. So Dr. Alaa Abd-Elsayed. He is the medical director at University of Wisconsin Pain Clinic. Make sure you check him out. He's giving you great information all the time, putting it out there so that people don't have to, they can seek help and then they can figure out what their problem is and find somebody that can help them one-on-one. So I appreciate everything you do. I'm so glad we met because I just loved this conversation. I think that you said so many important things for so many people. So thank you for being here.
No, thank you. And thanks for having me. And again, I enjoyed our discussion too. And keep doing what you're doing. It's very important and very impactful.
Thank you. And thank you all for joining us on the Tudor Dixon Podcast. As always, for this episode and others, go to TudorDixonPodcast.com. You can subscribe right there or check out the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts. And make sure you join us the next time. Have an awesome day.